Hello, everybody. I do think I am coming well placed, the coveted last slot, but also it does cover a lot of what's been talked about today, so I think it's really suitable for this time. But yes, basically today I'm going to talk to you about the white paper that was created by the Special Interest Group at the Chartered Institute of Ergonomics and Human Factors that focuses on healthcare AI. And it is basically going to follow the structure of this white paper to really give you a good understanding of the stuff that it discusses throughout. Let's see if this works. Excellent. So first, I'm going to talk a little bit about healthcare AI, but I'm not going to go too technical because there are people in this room who know a lot more about this than I do. But basically, with the aging population, the rise in multimorbidity, rising costs, staff shortage, and many other factors, and this includes the last 2 years, but I'm not going to go into detail in that, the healthcare system is struggling. And healthcare technology has been used previously to help address some of these problems, including with remote monitoring, remote consultations, and the development of electronic prescribing and electronic health records. And really, the next step is seen as artificial intelligence, or AI, which has the potential to transform the healthcare setting and provide support for healthcare professionals in general in areas such as diagnostics and monitoring for conditions such as sepsis and cancer. And some of this we have seen today already. However, with previous technological integration, there has been issues. And this includes patient harm and poor implementation, resulting in even poorer usability. And therefore, if we want to make sure that future AI does not experience similar issues, research has suggested we need to incorporate human factors into the development of this technology. Which really brings us quite nicely onto human factors. And human factors is used in other industries quite a lot, and this includes aviation. It's actually taught as part of the core pilot training now. And it also is used a lot in the heavy industry, including nuclear, and more recently with things such as driverless cars. But the move into healthcare was a little bit more recent and can be seen as being down to one man, really. And for those who haven't heard of Martin Bromley, basically, he is a pilot by trade. And unfortunately, his wife died as part of a routine surgery. And when he saw the reports for this, he realized that this actually wasn't down to the error of one human or one team. It was a systems error. And he realized that a lot of the stuff that he comes across in aviation could be applied to healthcare. And he became a champion for it. But what does it mean within healthcare? So here's a couple of definitions. Firstly, we have it's the scientific discipline concerned with understanding of interactions among humans and other elements of a system, and the profession that applies theory, principles, data, and other methods to optimize human well-being and overall system performance. Another definition could be the study of the interrelationship between humans, the tools and equipment they use in the workplace, and the environment in which they work. And lastly, and also my favorite way to define human factors, is it's the study of factors that make it easier to do work the right way. But definitions can actually only get you so far. So I wanted to give you an example. And this is my favorite picture way to describe human factors. And here's something that we call a desire path. And basically, these are created because people want to take the quickest route possible to get to their destination. And you see them everywhere. I see them a lot around Glasgow. I actually saw them on my walk here today from the city centre. And really, you have this design that was created. So in this case, it's an angular path that goes kind of it looks nice and angular. But the user experience is actually really different to what was designed. And this results in them making changes. And in this case, the creation of this desire path that kind of goes across the way. But in healthcare, this could be seen as a workaround. Now, if the design had taken a human factors approach and thought about the system and users in general from the outset, then the end product might have been more in line with what the users wanted, resulting in them not creating their own workaround or desire path. And basically, the aim of human factors in general is to take a systems approach, to take into account all elements of that system, to make sure that the innovation that is being developed is human-centric, and therefore more likely to be accepted, utilized correctly, and more importantly, safe for everybody. So now that you have an understanding of what human factors is, and I know this was a bit of a whistle-stop tour, I could talk about it for hours, and if you want to, please let me know. But I can now apply it to the world of healthcare AI. So there's been a lot of research into, in fact, there's a lot of human factors challenges that come about when integrating AI into healthcare, and that if not considered, will result in issues with safety within the setting. And this includes areas such as bias, and I'm going to talk about two main forms. So first you have automation bias, and this is a really big one. And this is basically when the healthcare professional takes the word of the AI for truth. It is correct. And they don't use their own clinical judgment and make a different decision, for example. They just trust the AI completely. Another type of bias is confirmation bias, which is where the AI confirms the healthcare professional's already formed decision. And this results in them not taking into account other people's views, not looking at other people's decisions, and therefore just basically confirming themselves. And there are other biases that come into play, and there's really nice figures out there and diagrams that show these types of biases, but I won't go into too much detail because, again, we would be here for hours. But other challenges include handover, and this is basically, when do you hand over control to the AI? Or when do you take it back? And who does this? And at what stage? And also, how do you hand over control of the AI at the end of a shift, and who to? And lastly, and related to handover, is supervision. Who supervises it? How much supervision do you give the AI? And at what points? And, we're all busy. Everybody in healthcare is busy. Therefore, who has the role of making sure that the AI is doing what it's meant to do and what it should be doing, and if there are issues? But these are some of the challenges that emerged. But how do you fix them? Well, simply, but not simply at all, we apply the discipline of human factors and take a systems perspective. And this has been mentioned already today. But you want to take a systems perspective rather than focusing on the technology itself. Lovely figure from the white paper. So I'm not saying that the technology isn't important, because without making sure the data is of high quality and unbiased, or that the algorithm is accurate, and also checking how it compares to humans, you actually wouldn't have any technology at all, and we wouldn't really be here today. But what the white paper and human factors discipline in general suggests is that we widen our focus and start taking a systems perspective. So this does include thinking about the data and how well the technology performs, but also considers other elements, which you'll see right here. And these are what I'm going to go into more detail about now. So, the white paper came up with 8 core principles that need to be considered when taking a systems perspective in the development of healthcare AI technology. And these are situational awareness, workload, automation bias, I've already mentioned that, explanation and trust, human AI teaming, training, relationships between staff and patients, and lastly, ethical issues. We don't have time for me to go into detail on all 8 of these, so I'm going to focus on 3, but I will cover them all in some level of detail. First, we have situational awareness, which refers to workers having a really good understanding of the situation that's happening around them. For example, a healthcare professional needs to have knowledge of the patient themselves, their needs, past medical history, and their current treatment. And this will be then used to inform future decisions that are made about their care. And situational awareness can be split into 3 levels, which you can see here in this box, again taken from the white paper. White paper is amazing. And this uses the example as anesthesia. So first, there's level 1, which refers to the perception of elements in the current system, with the example of an anesthesiast needing to be aware of the patient's vital signs, tests, treatments they've received, and also what other people are doing as part of their care, what other team members are doing. Moving on to level 2, and this refers to comprehension of the current situation. For example, the anesthesiast even, is able to bring together the data in level 1 and explain it to themselves, other healthcare professionals, and more importantly, the patient. And lastly, level 3, and this is a projection of future status, where the anesthesiast can anticipate what might happen in the future based on their understanding of the current situation, such as how a patient might respond to a treatment, for example. But why is this important in a healthcare AI context? Well, we need to have an understanding of what situational awareness requirements both the AI and the people have, and decide how they will share this information with each other, and including what format this will be in. Okay. And incorporating this is important as AI will both increase and decrease situational awareness. And this decrease can be due to several reasons, including that automation is there to reduce workload, but might also mean the healthcare professional is removed from the primary information and only presented with a recommendation, for example. And this can make it difficult to understand the context and why the decision was made, but more on that in a little bit. Another reason why is because the healthcare professional, for example, is now in a supervisory role and is able to focus on other tasks, and therefore this results in low situational awareness. And therefore it's really important to understand the impact that an AI will have on a person's situational awareness, and this can be done through several ways. First, you can understand the situational awareness at the design stage, and this includes understanding the domain, the tasks, and the requirements they have, by completing methods such as a task analysis, a cognitive work analysis, and a cognitive task analysis, for example. These are all human factors methods. And this will help to anticipate potential problems that may arise when integrating the AI into the healthcare system. But you can also assess situational awareness at a certain point, with methods such as the freeze, probe, recall method. And this is basically what it says on the tin. So there's a situation or simulation that a participant takes part in, and then it is frozen at a specific point. And then the researcher asks the participant questions about what was happening just before it froze. And this can then be used to understand their level of situational awareness at that specific point. But this is just an overview of 2 of the different methods you can use. And if you want more detail, you can read the white paper. But that is situational awareness. Now moving on to explanation and trust. And this has been brought up a lot today, and in different ways, different terms. It's got a lot of names apparently. But this is basically that the AI needs to explain how it came to its decision so that users can trust the output. Now, when the AI committee presented to the UK Parliament, they strongly recommended that all AI applications that could have a substantial impact on an individual's life will not be acceptable until it can generate a full, satisfactory explanation for its decision. Now, this is very important for healthcare AI, as well as explaining how it came to its recommendation, for example. There may be poor trust and delayed deployment, but also there might be a reduction in safety, as you don't know how it actually came to that decision in the first place. But how do you do this? Because, well, the community has made it very clear that AI needs to be explainable, but there isn't actually much agreement on how to do this. Often, it's provided as a post hoc overview, and this has been mentioned already today. And it kind of gives an overview of how the decision was made, such as highlighting the features within a data set that the algorithm used. However, there are issues with this, as AI tends to work on the basis of correlations within a data set, whereas humans often work with causation. And this may result in issues because while it's well known that correlation does not equal causation, and this is the one main thing that came out of my undergrad for me, and I use it every day, basically, we as humans may still misinterpret it as being causal, that one point causes another, when actually there's just a relationship between the two. So a way of removing this problem is that we have the explanation as a more social process, in the form of a conversation between 2 members of a team. And this means that the explanation needs to be interactive and allow for a dialogue and questions, that the explanation also needs to be suitable. So this means that it will be explained differently for a patient as compared to a healthcare professional, for example. Right. And basically, the AI should facilitate where appropriate, questions and actions by the user produce a suitable explanation for that person. And now, a nice example can be seen in box 14 from the white paper. And this is an example from a paper published in 2019. And this provides an example of the type of questions and actions a user could take. So you have things such as the user asking why the AI used a certain outcome or class, and also asking for more detail on their choice, and also a rationale for their decision. And you can see a really nice example over here, where the AI distinguishes between fish and dog. So you have the AI predicting that picture is a fish, and you can tell it's a Nemo just by looking at it. But the user doesn't quite understand how it came to that decision. So it can ask, why? Why did you come up with that? But if that's not enough, that how they explained it was not enough, you can then ask to see the type of training data that was used to come to that choice. So you can see that they use other pictures of Nemo to come to that decision. But again, the user might not be fully satisfied with the explanation. So they ask for the AI to remove the background, for example, to see that if the same decision would be made if that was the case. So this is a really good example of a kind of social process. And for this type of explanation, the person is able to interact with the AI and be an active participant in the decision-making process, which may support situational awareness, which I just spoke about, but also enhance human-AI teaming, which moves us nicely on to the third and final fully explained principles. Basically, this is about how we cannot design an AI without considering the team who are going to be using it and how they will be affected by it. And this is important because as AI applications get more advanced, which they are, we need to assume that they will be part of the wider team within that setting. And this includes clinical and non-clinical staff, and of course, patients. Therefore, how the AI works in the team needs to be considered when developing an AI. And if it isn't, there may be challenges regarding how the AI fits into the system, which might result in it not working, not being used, and not being safe. To make sure that the AI and human kind of team works together, we can actually just consider teamwork in general by looking at certain models, including the Big Five model of teamwork, which says there are 5 key team working behaviors, which are leadership, mutual performance monitoring, backup behavior, adaptability, and team orientation. And they say that if all 5 of these behaviors are taken into account, a team will work effectively. And this is really important for AI systems. And an example in the white paper is given on mutual performance monitoring, which is the ability to keep track of fellow team members' work while carrying out their own. And this is important because we need to make sure that the human team members are able to understand the AI system's role and responsibilities in that team, and also what it is doing, and know if the performance is actually effective at all. But overall, it's just really very important to consider how the AI will fit into the team already within the setting, and consider those who will be impacted by its integration. So that's the 3 principles I explained in detail, but I will go over the rest of them more briefly. See, nice ticks. So first we have workload, which is that we need to consider how the AI will impact on the workload of those already using it. As in certain situations, it will increase, and others, it will alleviate the workload. And a way to do this is to consider the different stakeholders and their tasks and how the AI may impact this. And there are specific methods given in the white paper. So that's workload. Next, we have automation bias, which I have mentioned previously. And again, this is where clinicians or healthcare professionals in general, for example, may overly rely on the AI for their decisions without providing any clinical judgment on the output. And a way to assess and mitigate against this is to make sure that the person has a really good understanding of the AI's capabilities. There are aspects such as explanation, which I've already discussed. So, automation bias. Training. Well, this is quite obvious, but this refers to new skill set that the people require when the AI is integrated. And also, people really need to have a baseline understanding of what AI is in general. And this means that training could provide that baseline understanding, but also train people on how to spot potential problems or wrong outputs, and also really the benefit of using it at all, because often, and as we've seen from a couple of presentations today, sometimes people are quite skeptical. There we go. The second to last one is the relationship between staff and patients and how this may be impacted. It may be that staff now work further away from the patient, which isn't a good thing because people want the human there with them. But there is now guidance on how to avoid this, and stakeholders should be made aware that the AI is not there to take away from this relationship, but to add to it and be part of a shared decision-making process. And this can be done through training, for example. And lastly, we have ethical issues, which I'm not going to go into too much detail about because we've just had a really great presentation about that. But this includes areas such as fairness, bias, and privacy. And these ethical issues need to be considered. And as we've seen, there is guidance set out that provides advice to make sure that the AI's development is robust and ethical. So that's ethical issues. So basically, the main conclusions from the white paper, and I do realize this is a very quick overview of what the content of it is, but basically we need to take a systems perspective and not focus solely on the technology in general, but consider the healthcare setting and the users within it. And to make sure that a systems perspective is taken, designers and developers really need to see human factors as an important part of product development. And further to this, there needs to be more education on what human factors is to both professionals and organizations. But really, we need to spread the word about human factors. So please tell everyone, tell your dogs, tell your neighbors, tell your colleagues about the discipline of human factors, because it really is so important and is about making life better. So thank you so much for listening to my talk. If you want access to the white paper, you can scan the nice QR code up on the slide. If that doesn't work, because I have had problems with QR codes working on presentations in the past, please come find me at the end, and I will hold my iPad in front of you, and you can scan it there. But thank you again, and if you have any questions, I'm happy to ask.